professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I am Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And it is with great honor that this year, along with Dr. Michael Zeroni from the School of Counseling, I'm presenting Social Determinants of Health, Geospatial Considerations in front of the Imaging and Geospatial Information Society. Um, this is really a conglomeration of multiple different types of theoretical frameworks, approaches, mapping techniques, all combined into one. So, in the next 12 minutes or so, I'll be explaining our work and providing you with some more insights as to how some models can be applied in education. So let's get started. So let's go over some of the objectives that we'll be going over today. So before anything, we'll be looking at some distribution of the prevalence of educational attainment. So we'll be exploring some of these in a geospatial mapping pattern within the United States. But in addition, what I'll be doing is kind of framing some of this information that you'll be looking at from a mapping perspective within the context of several uh, predominant existing models that I've done a lot of work with. So we're going to be combining social determinants of health, looking at some Healthy People 2030, 10 essential public health services. These will be the guiding framework. And then, of course, we'll be applying specific geographic examples of how complex models can make use of weighted regression. And I'm going to show you some of the parameters in one slide. And so please pay attention to that part. And then, very importantly, when you do have findings, how do you effectively, whether you're trying to implement at an institutional level or within the community level, how do you effectively implement this, internationalize this, or operationalize this and on a practical level? So this is the abstract. I'm not going to really read through it, but you can look it over. So geospatial considerations. Some important pieces to keep in mind when we're thinking about education and broad trends, right? So within really in the last 2 decades, there's been a rise in the number of students that have enrolled. And also more recently, due to the considerations and due to the environment from the pandemic, there was a lot of uncertainty. And so online education, distance education, became more and more vital to really delivery of education. So understanding some of the social nuances that have been related to education delivery systems, will allow us to better frame this and then provide targeted interventions in places where students may be having difficulties. So what does this mean? So let's start here. This is a map from 2015, and this really demonstrates some of the more important pockets where there is lower educational attainment. So I'm going to mark here areas where there are higher educational attainment, so some college, right? So some of the states here, and so if you look at New Mexico, there's some college, right? Down here. Texas has some college. But then when you look in Alabama, there's high school. Um, Georgia, there's bachelor's degree, but then of course South Carolina, some college. So what I'm trying to show you is that even though maybe on an overall level, there's about 70% of the people have at least some college education. The fact is that you have pockets within the country, geographical locations where there can be more improvement in educational attainment. So if we improve these geographical locations, then the communities at large improve, and then these communities then can better use as bootstraps some of these areas and build back the communities even better. So that's kind of the way that mapping can be used. I'm going to go a little bit more into the framework. But the idea is to detect population level education patterns and understand what is happening not only spatially, but also the nearest neighbors. So this gives us an instantaneous sort of idea about what exactly is going on at the local level, combining the composite of some predictor variables. So that's what I'm going to show a little bit later as to geographic weighting and why that is important. So we're going to be applying a combination of social determinants of health and healthy people 2030. What I mean by that, I'm just going to quickly go over this, is the fact that um, uh, part of the social determinants of health, education, access, and quality is included within that. Um, but it is really important to understand the technique by which we can really implement this within the community. So mapping can be really a powerful tool and a technique that we can take education, access, and quality and do something actionable about it and implement this within the community. So the best way to do so is understand the local contextual factors that are taking place in a particular area. So when we think about educational institutions, what we can better do is then understand some of the areas where student bodies are enrolling to certain institutions. For instance, um, I know certain universities where there's more enrollment from some states, whereas other states do not have as much. So if you are to map these areas out, then you can get a more precise understanding. Okay. So, what is the main crux of the model that we're looking at here? This was all a combination of not only the data that is available within county health rankings, but combining this with the American Community Survey data to give us a better overview about what is going on specifically at the local geographical geospatial level. So the predictor variables, there were six. Poor physical health days, poor mental health days, premature death, food environment index, physical inactivity, and flu vaccinations. And then some college education was the outcome variable. So what does this predict? So this is for one of the first times, this is showing so we had data at the county level. So this is showing and posing the question, is there a relationship between different types of health status, between different types of community level indicators, and the outcome of education? So we're saying that if there's a relationship, then if some physical health and mental health areas are addressed, then we can expect the community as a whole to have better educational attainment. Um, Knowing these, how does that help us though? That is the question. So let's turn this around a little bit. Let's switch this around and let's take a look. Let's suppose, and now this is not statistically speaking. So that first scenario I actually ran in a geographically weighted, a multi-scale geographically weighted regression model, and then looked at some Akai key information criteria to see which model was most informative. But say, for instance, we were to switch this around and say, if we improve education, then all of these outcome variables within the community will improve. If we were to create these models, imagine how powerful this can be in trying to improve specific facets. So this can inform both ways. On the other hand, if you encourage flu vaccinations within the university environment, then that in itself potentially, if there's a relationship, that in itself can potentially improve education levels. So see how you can actually draw information from this model if you take it bidirectionally. But let's take it from um, the outcome variables to one education predictor variable. What are the parameters of the model? It's important not to only just look at the outcome and the findings of the model, but also to look at kind of the gestalt, the whole picture. What is in the parameter? So it's a Gaussian distribution, normal distribution curve, which is most common. The number of FIPS data units. So the number of data units that were available were 3,003 FIPS units. There are in fact six covariates. The dependent variable was some college, and it took about 1 hour to run the whole model. So there's a slight error. It's actually six. So let's look at the results. And surprisingly enough, of course, you assume the null, but surprisingly enough, we were able to reject the null for every variable that was entered to predict the percentage of individuals within the county with some college education. So each one of these were predictors, which means that if we are to put emphasis on social determinants of health in addition to wellness, then a combination of these can really better address in a targeted way difficulties that students may be facing. So, I want to emphasize again these p-values, and these are all statistically significant. So, as you can see, poor physical health, poor mental health, premature death, food environment index, physical inactivity, and flu vaccinations. So let's bring in another model here. And this model is actually something that my colleague, Dr. Zeroni, has done extensive work on. And this model is actually the dynamic integration model. So this model is actually a combination of relational experiences, recreational experiences, vocational experiences. So part of this is actually understanding the idea behind the John Holland Code. So matching personalities with specific careers. So the idea is that if we can allow for personality characteristics, allow for cognition, wellness ideas on an ecological level, then in addition to thinking about the environmental factors, the social ecological model, we can also then tie in experiential experiential learning as well. So if we keep then thinking about these ideas and kind of continue onward, we can really understand the context of the environment from a social aspect and help guide students in a more targeted manner. And that allows to strive to support individual needs that can also improve the value and attractiveness of a university. And that is really important because you're really trying to improve in a way that is not only increasing and supporting your students, but also allows for other institutions and to see where those strides are being made. So if you then just putting this all together, if you want to conduct more research, then you can look at mapping from the context of access to education. You can also do location studies. So, what types of place factors? This is the question. What types of place factors play a role in the decision to even attend and enroll in the educational institution? Local education markets that you may be competing against, catchment areas, what are the attendance zones that are being covered? Labor market, housing. These are all parts of access questions. So, but before I conclude, I wanted to thank Dr. Bill Davis from the Public Health Department. I wanted to thank my colleagues in public health, and I also wanted to thank Dr. Susubak for some conversations in the process of various projects. So, thank you for this opportunity to present, and I hope you have enjoyed this presentation. Thank you.